All right, ladies, listen up. Whether you're needing gynecological care, approaching menopause, or concerned about heart disease or breast cancer, it is crucial you find health care you can trust. Dr. Rebecca Dunsmoor-Su joins me now to talk about Swedish Women's Wellness Program and the support they offer women. I'm really excited to talk about this because I really love this concept of a wellness program overall. So tell me, how did this come about?
So several years ago, Swedish brought together women who were sort of in the years after childbearing to talk about what were their unique needs and what were not being met by the current system. And out of that grew sort of the commitment to the Women's Wellness Program.
I think that's so important. And some of those needs, they vary.
Yes.
I mean, I know what I need. I know what my friends are going through.
Exactly.
So what kind of care does the program offer?
So we are general gynecologists, and so we offer general gynecologic care. But we focus in particular areas. So we focus on menopause, we focus on vulvar and vaginal disorders, sexual health, sexual pain. We also have a urogynecologist who focuses on incontinence and urinary issues as women age.
And it's a thing. It happens. You have some babies, even if not, it happens. I can tell you this too. My therapist, I say my gynecologist, she can also be a therapist too. I mean,
she can.
It's a time to talk about things, right?
It is. And a lot of women have increasing needs in terms of brain health and psychological health as they go through this time, and we have those services as well.
Now, if there are services that you don't provide, what do patients do?
So we are uniquely positioned to be a hub for women during this time of life, and so we have connections to primary care doctors and endocrinologists and cardiologists and neurologists and psychiatrists who understand women and the transitional time that they're in and can provide excellent care for them.
That is so key. If a woman is seeking OB care or gynecological care or any menopause guidance, why is this the best place for them?
So we have a particular understanding of where women are at that time of life.
Yeah.
And so we can really sort of coordinate a woman's care so that she is getting care that is appropriate to that time of life. We are up to date on the latest studies in terms of hormone therapy or other non-hormonal treatments. And we just really can be that bridging service for her.
You know, I think that a lot of women I know in my generation and the generation before me, and a lot of women probably going through menopause, talking about this stuff wasn't always the thing to do.
No.
And so when you don't talk about it, you're alone and you don't know if you're validated or not. Right. What would you say to anyone out there who maybe, let's say, isn't sure if this is normal, what they're going through with menopause or something of that nature, that they need that encouragement?
Yeah, so I talk about this a lot, and I spend a lot of time talking with women about what is and is not normal. We're not taught what's normal in the menopausal transition. We're taught how to become women in sort of sex ed, but we're not taught about the other side.
No.
And so what I do when I talk to women is say, you know, what you're experiencing is normal, but it may not be functional for you. So let's talk about what is good, what is not good, what do we need to manage for you so you can live a really long and healthy life.
Right, I love, high five on that one. Seriously, they don't tell us.
They don't.
What is the future of this clinic? Because I like where it's going. What are the plans for the future?
So we have a lot of plans for the future, as you can imagine. But the biggest thing is to really make that hub for women. We want to bring in pelvic floor physical therapy, psychiatry, cardiology, all those things that a woman needs as she ages, as well as building a more robust sexual health and sexual pain program. So women have that. Our urogynecology program is growing, so it's just going to be this amazing service line for women.
That sounds incredible, and it sounds so amazing that there is this kind of a one-stop shop, which is so hard in the medical field as it is. Thank you so much. Is there anything else you'd like to add?
No, I think that, you know, we see this as something that will just grow and grow in the future. You know, we as women have needed this service line for a long, long time. It's not that we don't have great doctors who've been doing this. We have great OB-GYNs and great family practitioners and great internal medicine doctors who've been taking this care of women, but it's nice to have it in one place.
Absolutely. Oh my gosh, thank you so much. It's been a pleasure talking to you, and thank you for all you do for women.
Thank you.
All right, to learn more or make an appointment at the Swedish Women's Wellness, you can visit the website on your screen. All right, now for something totally different. We are about to honor one of America's favorite snacks. We are going to talk about the origins of the corn dog. Oh yes, its cultural footprint, it has that, and why it is so good. Stick around.
This portion of New Day Northwest is sponsored by Swedish.